All right, check it out. Listen, if you got bad knees, you got to understand that you only have a few options. And if squats are not the best option for you, you might have to utilize modification. So right here, I've got a chair. What I'm gonna do is I'm gonna stand about 6 to 8 inches away from the chair, and I'm gonna focus on pushing my hips toward the seat and up, under control. Now what this is gonna do, this is gonna allow you to not focus on letting your knees track over your toes and putting so much stress on the patella. So you can practice on actually hinging at the hip, squatting, and up. Sit down and stand up if you have to, that's absolutely fine. But listen, if you have knee pain, we gotta modify these workouts to help you still utilize the hip hinge, the hip thrust, and extension. So the first thing we should do is just have a seat on the floor. Start off with a bridge, just doing both feet at the same time. Going up and down. Once you master both legs, that's great. Go ahead and do one leg at a time. Make sure you focus on control. All right? Now, the next exercise that you have, whether you're laying on the ground or standing up, is your side hips. You can work your side hips. So if you want to do a side lying leg lift, something like this, you're going to bend the down leg, then this up leg here, point the toe toward the ground, pull the ankle toward the body, up and drive, up and drive. And you can target those muscles around the hip. That's absolutely fine. You can do the same thing with the knee bent, up and drive. Now, these exercises will absolutely work perfect if you utilize a band around your knees or around your ankles. Now, check this out. Lunges. Lunges are not for everybody, especially when you're allowing the knee to track over the toe. So you don't have to worry about doing lunges and squats. But what you should focus on is doing things that allow you to slightly bend your knee and place bands around your knees and your ankles, side lateral walks, just like this, back and forth. Maintaining a quarter squat instead of a full squat is okay, because once we go into this slight knee bend, we're gonna activate our hamstrings, our quads, and these muscles around our hips. So even if we stay in this position and just go up and down with this slight range of motion, you're still going to get some benefit. Now, you have a pain, that's something you got to decide whether or not I need to go see a chiropractor, physical therapist, a physician, and I need to actually see what is going on with my body. All right, so if you're having knee pain, it's one thing to still try to get your workout in, but it's another thing to actually figure out what's actually going on with your body. My suggestion is to focus on the side lateral movements, okay? And then focus on the bridges. Side leg raises, things like fire hydrants, exercises like this, all fours, out to the side, up and drive, as well as donkey kicks like this, and extension, up and drive. Those exercises are great. If you're not a candidate for squats or some of these other exercises that make you squat down like this and you're putting pressure on all your joints like this, that's absolutely fine. I understand it. But what I would do is I would make sure, check in with your physician, check in with your therapist, and figure out what's actually going on. At the end of the day, you can't keep putting a Band-Aid on the problem, but still trying to find a solution. So, try these different exercises, add them to your routine. Practice makes progress. Let's work.